Hi, good morning. We're going to start. And I'm thrilled to welcome you all here today for the annual Summer Institute. 1 year here at OISE, 1 year at George Brown College. I want to thank you all very much for coming. I think it's going to be a really exciting and interesting day. And I really want to say thanks to Zenit, who has put this together and done such a fabulous job in doing so. And so we can just say thank you now. So I just want to start with a few ideas, just telling you a little bit about the Atkinson Center, and then just starting with a couple of ideas that I just want to frame what we're thinking about today. Sorry, I should have introduced myself. I'm Jenny Jenkins, and I'm the chair. I'm the Atkinson Chair at the University of Toronto here. So the Atkinson Center, the purpose of the Atkinson Center is to do high-quality research that informs practice and policy. So we're really interested in how do we build practice and policy, and we build that on the best research that we and others have done so that we can really build up a structure which is based on something that we know about well. And our partners in that we're from OISE, we're from the Institute of Child Study, we're from George Brown College, and the Atkinson Charitable Foundation also works with us on this. So that's what our mission is. That's what we're about. So let me just talk a little bit, a few ideas that I wanted to just convey to you is we're really a resource for people. So a lot of you are on the front line of practice or policy, and we should be a resource for you in thinking about how do you develop your programs, how do you evaluate your programs, what can the science behind early childhood do to help you to structure what you're doing in practice and policy. So that's one of our goals, is really to be a resource. We have, there are 7 or 8 faculty who are in the center. They've all got graduate students, so we have a lot of people who are working in and around the science of early childhood. So if there's something that you need that we can help on, then come to us. We want to be that kind of resource for people who are working in practice and policy. We are about public education, so we need to inform the public about what it is that we know about early childhood. How do children develop? What's the course of that development? How do they change? What predictability is there in their development? What are the contextual influences and the programs that really help them? So we know about those areas, and what we're trying to do is really disseminate that knowledge and find ways to disseminate that. If any of you are not, we have a listserv. If any of you are not on our listserv, then we'd really like to get you on the listserv. So if you could, at the table, at the desk, if you could leave a business card or just your name and email is completely fine. We'll put you on the listserv, and that's one of the ways that we're really trying to disseminate. Okay, I've talked about advice on design, and we are interested in partnerships. And those are a range of partnerships. We're working with people in education, in childcare. We're working with people in public health. We're trying to develop partnerships across all of the sectors that support the development of young children. Okay, so a few ideas about development that I just want to frame what we're talking about. So development is a complex mixture of influences. So we have macro level influences where we have neighborhoods, we have culture, we have families, parenting, marital conflict, how siblings get on. So those are more within families, micro processes within families. And then we have individual vulnerabilities of children. Those are cognitive, they're genetic. We're learning a lot about what makes certain children more vulnerable to negative environments, more susceptible to the bad effects of negative environments than other children. So some have more inbuilt resilience than others. We need to understand that better, and then we can foster that more effectively. We can help those kids more effectively. So 3 ideas that I want you to think about today. They are not the principal focus of what you're going to hear about today. Mainly today, you're going to hear about full-day kindergarten, the implementation of that, the fantastic development that's happening in our province to put that together, and the complexity of that. We're going to problem solve some of those issues that come up. But I also want you to think about this broader framework around children that I think we need to develop. We can't just think about schools, we can't just think about childcare, we have to think more broadly about the very broad context that children operate in. Let me just give you a few ideas about that. One is about social disadvantage. Social disadvantage is critical to what we see in development. And the first thing I'm going to say about it is around parenting problems. And the second thing I'm going to say about it is really is about inequalities in society and the effect of that on children's learning. The next point I want to make is about intervening in families, as the family context explains a ton about development. So although we're doing this wonderful work in schools, we can't forget that we have to be doing things supporting and helping parents. And how are we going to achieve that? That's part of the child and family centers. That's a wonderful part of the vision of children from zero upwards and how we're going to foster their development that Charles Pascal has talked about. And then the third thing that I want you to think about is by the time children are 18 months old, we can make a reasonable prediction about who will show problems on school entry. We know a lot about them when they're born, and we know even more within that first 18 months. So that gives us a long time to target interventions that are going to support health and growth. Okay, so around this idea of social disadvantage, I just want to say 2 things then. One, this macro risk. We know that low maternal education, poverty in general, socioeconomic factors filter down into the family so that you get non-optimal parenting in the family, which filters down to adverse effects on children and parents. So we have to think about what we can do about those macro level influences. This is a terrible slide, but an extremely important idea. So I apologize. This comes from a book called The Spirit Level by Wilkinson and Pickett, and it's showing you the impact of social disadvantage on learning. So if you just look up here, that what we're going from low to high, we're plotting the average of children's math and literacy scores. That's what's up going from low to high. And then what we're doing is we're looking at income inequality in societies. So we're taking the top 10% of the society and the bottom 10% of the society, and we're saying how much of a differential is there between this top and bottom parts of the society? How different are they in terms of income, in terms of earnings? And so we're low, this is low income inequality here, and we've got places like Finland right at the top, Norway. Canada is in the middle in terms of income inequality. And then we have places like the US, Portugal, the UK, which are higher on income inequality. And what this graph is showing you is that the lower the income inequality is, the higher the children's math and literacy is. Okay? So when you get to high income inequality, when there's really a huge difference in what the top 10% are earning and the bottom 10% are earning, you've got big problems with respect to children's math and literacy. But this, if you're interested in this topic, Spirit Level shows you 50 or 75 graphs of the same thing. So, but it's not literacy and math, it'll be crime, it'll be teenage pregnancies, it'll be dropout from school, it's cardiac heart risk, it's everything. So we have to think of the macro context when we think about how do we improve children's lives. We have to think about a society that is more equal. The next thing I want to say is that we have to intervene. Hang on, let's see. Okay. We must intervene in families, as the family context explains a lot about development. This is a study of 500,000 children tracked in the UK, and we're looking at their achievement at age 11, and then we're looking at their achievement at age 16, and we're looking at that, how that changes, and the contexts that have an impact on that change in the children's achievement, okay? And what we can see here, and this is a very complicated statistical model, so I'm not going to get into all of that at all, as I would bore you to death, although I find it exciting. But there are primary school effects, there are family effects, there are secondary school effects, there are pupil effects. That's what the neighborhood influences, and then the local education authority influence. So we're through looking at the clustering of children. How do these trajectories change over time in children? And through looking at that clustering, we're able to say a lot of that is due to the individual child. And we know that. There are things about brain development. There are things about early risk, including pregnancy problems, birth problems. And then there are genetic influences. So we know there are individual things about kids. There's a huge impact of the family, okay? And then the primary school and the secondary school also have a big, big impact. So these school effectiveness studies show us the same thing that this is showing us, that around 20% of how children do is attributable to schools. But about 40% is attributable to families, and that's why we've got to do something, helping and supporting the families that children grow up in. Now, that family, not to mislead you, is including both environmental influences and genetic ones. But the family is absolutely, what goes on there is important in our thinking about how to support children. So the last point that I want to make is that by 18 months, we can make a reasonable prediction about what's going to happen on school entry. This is just about language. What I'm showing you here is just a language. So the largest bit is unexplained. That's variability, and that is absolutely the case. The children are variable. They just change from one point in time to another. And so that influences development. But then we've got these other big chunks of about half of it we can predict before 18 months. And we can do that by a mixture of their socio-demographics, the things I was just talking to you about, by neighborhood influences, by child language influences, so how the kids are doing themselves earlier on their language, and very strong parenting effects that Jan and I will talk about later on. Okay, so just to wrap up this idea then, I think the issue of social disadvantage as it's central to child development prevention programs have got to address this. We have to intervene in families. How do we do that family intervention? Where do we do it? Do we do it in schools? Do we do it through communities? Where and how do we do it? Do we do it on the internet by talking to people? Do we do it through phone apps? Jane Bertrand had a great idea yesterday about the phone app. And then the last point is, because we can do this prediction, we can early on think about universal and targeted programs that will support development in children. Last thing then is we have to think in terms of universal interventions, and that's because we do not know, we cannot predict perfectly. So we have to do who's going to be at risk. We have to do universal programming so that we can really support development. But there are kids who need that much, much more, and I showed you that in one of the slides. There are individually vulnerable children, and because we can make predictions about that differential susceptibility to environmental influence, we have to target those kids. That's all I want to say, and now I'm going to introduce Olivia Nuamah, who will talk to you next from the Atkinson Charitable Foundation. So, Olivia is the executive director of the Atkinson Foundation. She was raised in Toronto, and then she moved to London, where she had jobs both in government and in the wonderful Sure Start program, which I'm sure many of you are familiar with, community-based programs to support the development of children. They're tracking the impact of that evaluation at the moment. She's an extremely impressive leader, a policy expert, and a social justice advocate. She's passionate about making a better world for children. So we're going to capture, I have loved, since Olivia came to Toronto, I have loved interacting with her, and we're going to capture some of that passion for our U of T students. Olivia is going to help us in a child policy course, do some teaching, trying to build up the students' understanding and awareness of these issues and how to intervene. So come and talk to us.
Well, thank you, Jenny. That was incredibly kind, if entirely unnecessary. Well, hello. It absolutely fills me with joy to be in a room full of people who are not only interested in the subject, but certainly interested in trying to make the lives of families and children continually better. And it's an honor that you give your time to us in this way. So thank you for giving me this few brief moments just to have a discussion with you about our organization, what we hope and aim to do in this subject, and certainly how we hope and aim to do it. We are a foundation for whom, for over 50 years, has been dedicated to supporting low-income communities, and particularly dedicated to doing that through supporting children and their families, but particularly children. The family thing has become, I think, a later development for a whole load of reasons. So for over a decade, we've been focusing our resources on trying to develop a way in which we can demonstrate the sustainability of policy through the effectiveness of implementation. And for those of you who know Toronto First Duty, I was having a conversation with somebody yesterday and saying to them in sort of in awe of Charles, really, because 15 years ago, nobody really wanted to do evidence-based policymaking. We sort of separated policymaking into those that sort of really knew and those that needed help. And the great thing about this piece of work is a part of the reason why we are boasting the success we are is because this man thought, you know, perhaps what we can do is show people, instead of constantly trying to berate them, show them what works and show them how it can work. And it's an amazing success that we sit here today and we have got a liberal government and a conservative government fighting over who can do this better and quicker. It's amazing that we are in a time where we are talking about children and their families in a way that's interactive, in a way that puts them at the center of decision making, and a whole policy and academic discourse that says, actually, in order to deliver effective services to this group of people, we need to do it through them and not for them. It needs to be done by them. And that's what Toronto First Duty really did. It really said, you know, this is how it can be done. And a colleague and now friend was saying to me yesterday that it's incredible because 15 years ago, nobody wanted to do this. And as a foundation, it was an incredible risk to put ourselves front and center and say, you know what, this can be done, and it can be done better, and it can be done well, and it can be done in a way that is efficient for the public purse. So I give that to you as background. Through these activities and the vibrant collaboration between the Atkinson Center, OISE, and the Eric Jackman Institute of Child Study, we are here today to really try to move forward this agenda even more. Because, you know, as public policy and public practice people, we always want to do better. We always want to constantly be trying to say, how is it we can reach these community and these communities and vulnerable people better, more efficiently, and with their best outcomes in mind. So the province of Ontario and other provinces throughout Canada are starting to roll out an early learning vision for children and families. And that early learning vision effectively starts, not entirely starts, but sort of effectively starts to symbolize that process through the work that we began to do 10 to 15 years ago. And the platform exists because of several things, and we don't take for granted what we are as a foundation. We know that what we do best is communicate very complex ideas simply and do that in a way that is accessible to people. We know that the best way to do that is to do that through evidence-based decision-making, and that communication is entirely underpinned with the evidence base that Jenny so eloquently explained to you earlier. And we do that through understanding that those mean absolutely nothing unless a government decides that it's going to take it on board and it's going to implement it. And here we are, and we've got governments across the country looking at how they do early learning and care. We are talking about trying to provide a basis for children's learning through a play-based curriculum. And we are underpinning all of that with a rigorous scientific evidence base. In case people decide, in case people continue along the kinds of lines that suggest that those are different research institutions, that science is different from the practice of engaging people, which is different from the practice of policy. Because what this example best shows is that they are absolutely not different. That one has to feed into the other, and that has to feed into the other. And the next conversation certainly we will be having as a foundation is how to ensure that government continues to do this as a part of its own business, as opposed to relying on foundations and perhaps their willing commitment to continue this conversation. So I'm pleased to announce that the Atkinson Foundation is committed to continuing to build the capacity at the Atkinson Center and enhance both knowledge generation and knowledge translation. Our commitment includes supporting the partnership between the Atkinson Center, OISE, and the Eric Jackman Institute of Child Study and George Brown College. As a part of a 5-year plan, we're appointing Carrie McQuaig as the Atkinson Early Learning Policy Fellow. The Atkinson Fellow will join the Atkinson Center Chair, Jenny, and George Brown College faculty and seconded to the Atkinson Center, Zenit, Together, they will build the Atkinson Center to communicate policy, research, and practice related to early learning, to childhood, and to children's development and to families. And I must say here that our commitment is over $1 million. And so we are putting our money where our mouth is. And we are trying to support you to help you do your jobs better. And we're hoping, as Jenny rightly described, that you will use the resources here to support you in your work. And you'll use us to do that too, because we recognize that without any you, there's no way we can do evidence-based policy making, and there's certainly no way we can start to engage the voices of parents to try to make this real for them. The Atkinson Center will also expand its work in collaboration with the Center of Excellence in ECD, based in Montreal. We will be working over the next few months to develop a detailed plan, and work will begin early July 2012. The Margaret Wallace McCain Family Foundation will join us in expanding the policy capacity of the Atkinson Center, and possibly other funders will add their support along the way. We're very excited about this next phase of our partnership during what continues to be an exciting time in Ontario, and we're pleased to be taking part in this annual Summer Institute. Thank you very much for your time.